LEANNE Owen became a member of the CHS Alberta chapter in 2010 after her son was born with hemophilia. She joined the board of directors team in 2011 as a vice president, was chair of the CHS National Website Task Force, and was previously a member of the Alberta Galdai Family Camp Committee, Camp Candle Committee, Casino Volunteer Team, and Advocacy Team. The CHS has helped her meet families with similar challenges and has also been an advocate for herself and her family during difficult times. LEANNE and her husband, Corey, are currently focused on advocating to get emicizumab available for patients in Canada that need it most, and supporting other families by sharing their experiences since their son has started using emicizumab in 2018. So, LEANNE.
Hi there. Good morning, and thank you for having me here today. I was invited to this conference to share our family's journey with hemophilia and the new product emicizumab, also known as Hemlibra or previously known as ACE910. My son Jace was diagnosed with hemophilia A severe at birth. He developed inhibitors at 14 months age after being on Advate for 6 months. As per most inhibitors, we were advised to start him on FIBA. It worked for the first few doses, but we had to stop using it due to 2 anaphylactic reactions. His inhibitor BTU levels was low at the time, so our HTC decided to schedule surgery to have an IVAD implanted and to start him on immune tolerance induction therapy using Wilate. He was successful on Wilate for 3 years, even though his inhibitor was never quite eradicated. He was bleed-free for that time. Jace was around 5 years old when the bleeds began one after the other, and often several at the same time. Wilate was no longer working for him. We tried a round of rituximab and higher doses of Wilate, but still could not control the bleeding. We were infusing up to 5 times per day using Wilate and niastase together. We gave him his meds at home and at school every couple of hours. He had to rely on a walker, a wheelchair, or help from an adult to get around at school. Crutches were causing him crutches were causing arm bleeds, and the walker was causing him hand bleeds. He had bleeds so frequently that we needed
No.
Good? Yeah. Okay. Crutches were causing arm bleeds, and the walker causing hand bleeds. He had bleeds so frequently that we needed to leave his IVAD access for long periods of time, causing it to eventually need replacing several times over the next few years. We attended the CHS Inhibitor Summit and consulted with Dr. Carcao and Dr. Rivard, and together with Dr. Bellatruti decided to start Jace on Aloctate. Aloctate worked for a few months, and Jace was bleed-free and feeling better. Then the hemophilia bruising we are all too familiar with started to reappear. We tried another round of rituximab treatments and higher doses of Aloctate with 0 success. Jace was 7 years old, and it seemed the only drug left for him was niastase. We used niastase for prophylaxis, which had its challenges with only a 2-hour half-life. He was in and out of the hospital for months, therefore missing several days of school, and my husband and I missing several days of work. Our older son, Kale, was missing his little brother and his family being all together. Just when we thought things were bad, they got worse. We were released from one of our weekly stays at the hospital. Our family got to spend a nice day at home all together, and Jace innocently jumped off his bed, causing a right ankle bleed. We administered niastase at home every 2 hours, as we usually do, but it was not helping. It was a long night of pain for Jace. Usually Tylenol worked for his pain, but that was doing nothing for him at the time. In the morning, off to the hospital we went. He was given morphine for the pain, and this still was not helping. He ended up being hospitalized for 2 months. He was in excruciating pain from the right ankle bleed. The pain team was brought in, but complications kept coming. He developed a bone infection, was treated with IV antibiotics that caused a reaction, and caused him to be very sick and had a rash all over his body for periods of time. There were days he did not sleep and would scream from the pain. I consulted with my uncle, who lived through the tainted blood tragedy. When there was little factor, he advised the bleeds would stop without factor, but would be very painful and take time. It was horrible to watch and not be able to help Jace. There was a moment when Jace asked me if he was going to die. He was 7 years old. We knew emicizumab was our best and only option, but it was not yet available in Canada. Jace had been previously denied access to emicizumab because he was under 12 years old. There was no clinical trials available for him to take part in. My husband and I reached out to everyone we knew to help us rally to get this medication for Jace. CHS National, David Page, our HTC Dr. Bellatrudy, Heather Bowman, the other Edmonton hematologists, and after submitting a very well-crafted strategic summary of Jace's case and a hard push from CHS National, Together Health Canada and Roche granted Jace, my son, compassionate care use of emicizumab. This meant Jace would be able to use emicizumab even though it was not available in Canada. It was my understanding that Jace and only one other boy in Canada were currently on the drug. On April 11th, 2018, a new day we call Hemlibra Day, because that's what it was called back when he was given it. Weeks after being in the hospital, Jace received his first dose of emicizumab at the University of Alberta Hospital in Edmonton. The drug started working immediately. We were discharged from the hospital the next day. With a lot of physio appointments and hard work, Jace was running at recess and playing with his friends weeks later. With a slight limp, within 2 months, Jace had a full recovery and there was 0 signs of long-term damage in his right ankle. It was amazing. I recently read an article that summed up how I feel nowadays. This is a quote I borrowed from that article. In our home these days, hemophilia is like a family member who stops by for a fleeting visit, just long enough to say hello and give a quick hug, but not long enough for a cup of coffee. This past year has been busy, with Jace joining school sports teams like handball, running club, and basketball, going outside for recess and participating in gym class, playing with friends, and even going on the odd trampoline. Sorry. Our family has had no interruptions from hemophilia's unpredictability. We have gone on camping trips, vacationed in Mexico, which I would have never gone to that country before this, and Las Vegas. Jace was recently granted a wish from the Make-A-Wish Foundation. Our family flew to Las Vegas and Jace met his hockey hero, Marc-Andre Fleury, the goalie from the Las Vegas Golden Knights NHL team. He spent the day with the team, including skating during practice with the whole team. Jace and my older son, Cale, were also invited to be on the team bench for warm-up and the singing of the national anthem during Vegas's game the following night against the Nashville Predators. When the team won that day, breaking a 5-game losing streak, I got a text and it was inviting the boys to go down to the dressing room to celebrate with the whole team. It was mind-blowing and something our family will not soon forget. We used to travel with 3 suitcases full of medication and supplies. We now travel with a small backpack Jace carries on his own back. There were big changes for Jace when we started emicizumab. It is given subcutaneously, so the needle we now use is very short, especially compared to the IVAD needles we previously used. Jace does not have a lot of fat on his body, so we administer his injections in his arms or thighs. We infuse weekly for Jace to ensure his levels remain high. Emicizumab has a half-life of approximately 4 weeks, so for us infusing weekly, we know he is always protected. Jace was very nervous about not using his IVAD any longer and having to get a needle in his arm or leg. Through consistency and several distraction techniques, like having a staring competition with his older brother while getting his needle, the subcutaneous injections are becoming less stressful for him. The shot itself takes about 20 seconds to administer. Surgeries have been a lot easier for Jace on emicizumab as well. Jace needed 2 teeth extracted in December. We gave him no factor 8. He received his normal dose of emicizumab on Monday, and on Friday, we had the surgery. He had the surgery. We went home after an hour, and there was 0 bleeding. His IVAD that we had not used in the last year, besides flushing it with saline every 3 weeks, had a complication. I could no longer push the saline. Jace had a history of the line in his IVADs breaking or cracking. So into the ER we went, and they decided to take out his IVAD. He had the surgery, and 24 hours later we went home. Again, no extra factor was administered. Life has really changed for Jace. He has not had 1 bleed since April 11th, 2018, Hemlibra Day, the day of his first emicizumab injection. That is over 1 year bleed-free, something I thought was unreachable. We never dreamed that this would become the reality for Jace. It's becoming easier to put hemophilia out of our minds until the weekly dose of emicizumab every Monday evening. My perspective on hemophilia has changed significantly over the past year. I'm grateful that my son is thriving and hemophilia is now merely a small aspect of our lives. Forgetting about the past is much easier these days, but I need to ensure that those memories do not fade. We have been in the thick of the worst that hemophilia can bring, and we are relieved to be on the other side of that fight, at least for now. For those of you in the heat of the battle with a bleeding disorder, I understand your pain, and you are not alone. We know we are lucky to be where we are today. And if Jace was not granted compassionate care a year ago, our lives would be very different. I said I wouldn't cry, and I'm crying. Okay, as explained, emicizumab has been life-changing for our son and for our family. You're supposed to make me not cry. That's my husband. Okay. My focus over the past year has been and continues to be advocating to get emicizumab available to other patients in Canada. While emicizumab is not a cure, I truly believe it is a viable option, especially for hemophilia patients with inhibitors that are having troubles with other available products. For Jace, so far, his body has not developed inhibitors to this drug, like it did all of the others. This is because emicizumab is not trying to replace factor VIII, which is not known in his body, but instead it mimics the action of factor VIII by binding to both factor IX and factor X in place of the missing factor VIII. The future looks promising. Thank you.